Great.
So
So
my
again, welcome everybody. And Dr. Martinez is going to tell you who he is and how we got connected, and give you some information. At the end, I will pause the video and the recording, and you guys can ask all the questions you need. Take it away.
Awesome. So thank you for having me, Tammy. My name is Dr. Henry Martinez, and I am a board certified pediatric dentist. I'm a fellow of the American Academy of Pediatric Dentistry. I own a practice here in Ahwatukee called Big Apple Pediatric Dentistry. And I am also the section chief of dentistry at Phoenix Children's Hospital. So today I just wanted to share some tips on preparing your child or children for a successful dental visit, or their first visit coming to the dentist. I know it can be quite challenging for any parent to get to prepare their child for their dental visits. And I just want to share some ways that we can help to make that a successful visit. And so I got connected though with Tammy through some colleagues, but I have been down there to tour the facility. It is a great facility, and I really try to be a champion for special needs patients through Special Olympics of Arizona. I'm one of the clinical directors there, and I've had a lot of training with special needs patients throughout my career. And I actually teach dental students and residents how to treat and train for treating this special needs patients. So I'm going to go ahead and I'm going to start here. So one of the key things you want to do when selecting for preparing your child for their first dental visit is selecting the right dentist. And so what you want to do is you want to primarily kind of look at a pediatric dentist. Pediatric dentists are going to be the ones that are trained to treat patients with special needs, trained to treat kids with all different types of situations. But the one caveat there is not all pediatric dentists treat patients with special needs or do not have the training there. So that's an important concept there. And so what I always tell parents is whenever you're trying to find a dentist, you want to call the office and you want to tell them, hey, these are the needs of my child. This is their first dental visit. And a lot of times the dental office will go ahead and they've dealt with a number of ways to talk with parents about how to prepare them for their first dental visits. But that is just choosing the right dentist. And again, there's so many different avenues on choosing the right dentist these days. You want to look at Google reviews. You want to look at talk with friends, talk with colleagues, if families. And so it's always a good idea to choose the right pediatric dentist for your child. Schedule wisely. And that means if your child is going to do better in the morning versus the afternoon, it might be better to choose a morning appointment. Typically in a pediatric office, the afternoon is always going to be a lot more busy just because kids are out of school. And the typical pediatric dental office is going to have an open bay concept where they have 3 or 4 dental chairs set up in a big, large room. And the whole idea behind that early on was that kids can see other kids, see how, just to kind of get a visual of what to expect when someone's cleaning your teeth, when the dentist is checking their teeth. It also accommodates parents with large families, with 3 to 4 kids. They can all share a room. But however, if your child is going to do better with an enclosed room or just having a separated room, that's something that you should let the dental office know ahead of time. They can prepare. My office does have separate rooms, enclosed rooms, to make it more comfortable. Should a patient do not need all of the have all the other patients around. So we do want to accommodate those patients who require a little bit more comfort. We also have in our practice what's called a desensitization, or we use it as our infant room. And it's basically a room where we can do exams for patients, and it doesn't have suctions, it doesn't have scary sounds, it has toys, it has couches. It's just a very comfortable area for patients to just we can get their cleaning done, we can get their exam done, and it's just a non-threatening room. And it's actually one of the big highlights of our practice chances are most pediatric offices do have just a room without suctions, without sounds, just to be able to make that first dental visit a comfortable and enjoyable one. One of the other things you'd want to do is try to practice at home with your child. Maybe do a little role playing with a toothbrush. The other thing too that kids respond really well to is watching videos of going to the dentist. There's numerous ones you can find on YouTube. There's Peppa Pig going to the dentist. There's Elmo goes to the dentist. There's so many great ones. There's Bluey goes to the dentist. Kids do really well when they can watch a video, and it gets them excited to coming into to their first dental visits. And the other thing you can do, and we do this for a good number of our patients, is not even have the patient or not even have them come in for their first cleaning. Maybe just stop by the office, tour the office, and that is a part of, if the patient is really scared, really nervous and anxious, the first step we do is we have them just walk in the waiting room, and maybe they just have a seat there. And we just kind of see how they're doing. And if they want to come in and tour the office when there's nobody around, maybe it's a lunchtime, they want to come in and tour the office, we do that for patients. And so one thing we'll do is sometimes for patients, we will have them come in, sit in the chair for one visit, and maybe do an exam, and that's it. And then they come back a second time, and maybe that's when they can get a little more comfortable. We do their cleaning. And then maybe the third or the fourth time is when we try doing x-rays. So we really try to accommodate patients as best as we can. We want to get them desensitized to coming into the dental office. One of the other things that we do like to consider is having your child bring a comfort item with them, whether that's a stuffy toy, whether that's their own toothbrush and toothpaste. Some kids are going to be particular to certain types of toothpaste, certain types of textures. The Profi paste that we use for our patients is a little bit more gritty. So sometimes we will kind of clean their teeth with the toothpaste that they're comfortable with. So that seems to work out really well. We have a few patients that just always bring in their own toothpaste, their own toothbrushes, and then we work up to using the little spin brush for them to here in the office to clean their teeth. We have patients that are particular with certain types of taste. And so we have different types of flavors for kids. And so we will let them choose their flavor. But if it's something that we don't have, say it's a vanilla, say it's a lavender type of toothpaste, there's so many different flavors you can find on the market. We'll have them bring that in to be able to get their cleaning done, and for them not to be scared of the Profi paste, of the grittiness of it, and allow them to just have a little more comfort. And the other thing too that what you want to do is you want to make sure you find an office that is going to take their time with your child. Not every kid is going to sit in the chair and allow for a cleaning, and we understand that as a pediatric dental office. We understand that every kid is different, and so some kids we're going to take 15-20 minutes to get their cleaning done. Other kids, we may take a half an hour or 45 minutes. But taking our time is one of the things that really distinguishes our office. And we have phenomenal assistants that are able to do that. And so that's another thing too that you want to look at in the reviews when you're trying to choose a pediatric dental office, is that do they take the time for other kids? How are they react? How is the staff interacting with other kids? And so that's one thing to kind of keep in mind. And then communication. Here in a pediatric dental setting, we use different words to go ahead and to describe things to kids. We say toothpaste, we say toothbrush, but the toothbrush can mean a little Profi angle, which is basically the thing that spins around and kind of cleans your teeth. We call that a toothbrush. The toothpaste, we refer to that as the Profi paste. That's a little bit more gritty. And so we say our fluoride varnish that we put on for kids, we call that the vitamin. So we like to use words that a child's going to understand. And so, when we have to put a tooth to sleep and we have to get it numb, we talk about putting it to sleep, having it take a little nap, putting a little bit of cold on that tooth. And so just using simple language and positive language for kids is going to make a huge, huge difference there for them in their understanding. And so one of the great things in our practice is the positivity and the praise, and that's something that should be done at every dental visit. We like to celebrate every success that our patients do. Whether that's the first time them opening their mouth, whether that's the first time sitting in the chair, we celebrate those successes with them. We give rewards. And so that's our little token tower right there. We give stickers, we give tokens. That's our treasure tower. Every kid, no matter how bad they do or how good they do, they always get a little prize, a little token to get a prize out of the treasure tower. We like to really focus on the positive here in our practice. And I'll tell you what, that's probably one of the things later on in my presentation. For all the kids that come into our practice, no matter how scared they are for their first initial, maybe couple visits, they always end up having success. And so it's just taking time, it's meeting them on their terms. And so your kid can have success. You just have to give it a little bit of time sometimes, and we all do. And that's one of the things here that we try to teach for our patients is just be patient with them. And we want the parents to be patient as well too. Like I said, the first few visits might be just establishing trust, taking our time to complete exam, cleaning, x-rays. Like I said, it could be broken up into several visits. Sometimes kids do amazing and they do it all in one visit, you know, and it's when you least expect it. And then your child, the other thing too, is parents do come in, you're nervous, you're anxious. I have a son myself. And so when they go to the doctors, you do get a little anxious, and kids always pick up on the stress of their parents. And so just trying to stay as relaxed as you can. That's one of the best things you can do for your child. Being flexible on the goals for your child. Sometimes we want to make sure we want we find a new office, we want to go in, we think the kids are going to do amazing. They're going to sit there and they're going to get their teeth cleaned and they're going to do x-rays. And sometimes these things don't go according to plan. So that's okay. Just being flexible on our goals and being able to kind of manage those expectations. That's one of the big things there. And then giving your child time. Like I said, from the beginning, every child can do good in a pediatric dental setting. Every child can do great in our practice. It's just taking time and being patient for them. So here are some toothbrushes at home. There's these are specifically for patients that have difficulty with brushing, patients with special needs. This is a 3-sided toothbrush on the left, and that's great to use. And so I always advise parents to go to Amazon. Amazon seems to be the best place to find toothbrushes. You're not going to find a whole lot of toothbrushes that are going to meet your needs at Target, Walmart, any of those places. Amazon just seems to be the best place there. And that's a 3-sided toothbrush. Those are great to get in there and to brush your teeth. If your child isn't allowing to get in there and brush, and all you can get maybe is like a 1 or 2 second brush, that's great to use. The one on the right is a 3-sided toothbrush as well too. The bristles are just a little bit more kind of softer. And so using that can work out great. Like I said, don't be afraid to just use water. If your child doesn't like the grittiness, if your child doesn't like that certain flavor you have, then water is okay to use. Ideally, you want to use a toothpaste. There's different types of toothpaste you can use. There's a fluoridated toothpaste you can use. There's another product, I don't think I have it on here, but it's called the nano hydroxyapatite toothpaste. Works great. There's a brand called Boca that's out there. I've recommended it to patients who didn't want to use fluoride, but were high caries risk or parents had trouble brushing. That's a great brand to use. What I like about that type of brand there, and again, there's no paid advertisement. I just like to use that type of toothpaste for that's one I've had success with. There's certain types of flavors that they have. I have special needs patients that only like vanilla. They don't like strawberry, cherry, mint. They don't like any of those. They only like a vanilla. Well, we found a vanilla flavor that they're very accepting of in that Boca brand. And so those types of toothpaste are where you're going to have a lot of success with brushing there. So like I said, but if you're just starting out or if you have difficulty, water is going to be just fine there. Okay. And again, when it comes to brushing for your at home, if you can get 2 minutes for your child to brush, awesome, amazing. If not, just do the best you can. If you start out and you just have to brush the front teeth for a certain time period, that's okay. Don't be afraid to do that. If your child only allows one side to get brushed and you got to break it up into different type of visits, almost just maybe brushing, taking a break, coming back and brushing again, another 30 minutes later, don't be afraid to do that. Brushing can be done on your terms. It could be done on the child's terms, but it's just, The whole point of brushing is to remove a lot of the plaque that adheres to the tooth in order to prevent cavities from further progressing. And flossing too, what I usually recommend for flossing are going to be the flosser picks. Those are going to be great and easy to use. I don't have a picture of it, but you can buy those over the counter. When you come into our practice, we give our patients, we always give them samples of those picks. Those seem to work out really great. If you use string floss, for your child to floss, awesome. Not a lot of kids like to have the string floss in their mouth because of putting fingers in their mouth. So those flosser picks are a great option. But my biggest advice is just making things simple and trying to just do what you can, and then just trying to build up each visit there or each time you're brushing there for them. Ideally, when it comes to brushing, you want to try to do it twice a day. And it's mostly when you're doing it morning and night, it's building that routine. Now, the biggest time, the more important time, what I tell parents is going to be that nighttime brushing. That nighttime brushing is going to be more important because when we fall asleep, our saliva content decreases. And so that's when, if your child's a mouth breather, if you're just basically breathing, you have the bacteria there that's on the tooth surface. The saliva content decreases, and that creates and that harbors the environment for cavities to kind of grow and fester there. So the nighttime brushing is the more important one. And I just have on here Phoenix Children's Hospital. If your child does require dental treatment in a hospital, we are honestly one of only 4 offices in the whole state that has privileges there at Phoenix Children's Hospital. We can certainly get all of their dental treatment taken care of there if need be. And we're talking about if patients have cardiac conditions, if they have pulmonary conditions, if they have certain type of airway anomalies, syndromes, we can get it all taken care of. I see patients of all different types of medical histories and medical concerns over there at Phoenix Children's Hospital. We do utilize in-office general anesthesia if needed. We do utilize oral sedation where patients do drink a little medication and helps them relax. We do that. And, again, if we can avoid all that, that's even better there. So I just wanted to make you all aware that we are one of the few offices that can provide that care. And that's our practice there. We're located in Ahwatukee. And here's our website, our office email, our phone number. And we have tons of patients. I even have patients that are in their 30s and 40s that have special needs, and I've been seeing them for 10 plus years. And I've just, I want to make sure that they get great care. We've established a good rapport. And so I do see patients, special needs patients are patients that I will see later on in life, because when we don't graduate patients. And so there's very few general dentists that have training to see patients with special needs. And so that's where we like to just, create that dental home environment for our patients and that longstanding care for them. So I'm happy to answer any questions that you have. I'm happy to give you any recommendations. So, but thank you for allowing me to present to you all today. I really appreciate it.
Beautiful. I'm going to stop the recording. So if you guys do have questions for Dr. Martinez, you can ask specific to your child. But let me pause that first. Thanks, guys.